Mental health is a growing problem nationwide, but one of the biggest issues that comes along with it is a lack of system to support the growing need.
April Hettinger and Cassidy Zimmerick joins us in the studio in a two-part story on NAU's mental health services.
The past few weeks, we have been looking into how mental health is affecting the NAU community, including students and faculty.
NAU is struggling to book counseling appointments for students, but we've realized this problem is happening not just here, but in campuses across the United States.
According to the Coconino County Suicide Report in 2017, every 2 weeks someone commits suicide, but this is just a number.
I think sometimes that when we get caught up in data and statistics, we forget that there's human beings behind those numbers. One person is too much. One human life is too much. So I don't like to compare, because then it makes it seem like one person's life outvalues another.
The data shows suicide was the second leading cause of death among 20 to 44-year-olds in the county.
Coconino County and most of the American West do show that we are at an increased rate for suicide. And I heard the other day that we're on par to reach the same level that we were at last year.
Jennifer Runge has a personal connection to suicide and encourages taking the first step. Coming to terms with your thoughts.
A year ago, my then 18-year-old daughter woke me up in the middle of the night to say that she'd been having suicidal ideations for about 3 months. And the only thing that had held her back was the fact that she knew that her younger sister would be the one that would find her. And so she made an awesome step that she was willing to come forward, wake me up, and be willing to admit what had happened.
Students in a communication ethics course are working toward improving services at NAU because they have struggled themselves.
I've always struggled with some sort of mental health. I went to U of A for a year and I left because my dad committed suicide.
I was in a situation my freshman year where I needed it and it wasn't available to me, and so I turned to more destructive motives, and I don't want anybody coming into NAU to follow down the same path.
It can be just as daunting when a student approaches faculty for help.
As a faculty member who has been talking to a fair few students with mental health issues, it's important to know where the resources are.
The struggle doesn't end there. Lately, NAU has been following a crisis-only model, a result of not having enough counselors and funding on campus.
Getting into a long-term counselor can kind of be a process. You know, sometimes they're booked, or the next appointment is like 2 months out, and that's just too far out.
So it's impossible to get appointments for a lot of students. They have to try like every day. And still, oftentimes it takes weeks to get an appointment.
This is a problem on all college campuses, not just Flagstaff.
Mental health, suicide prevention, this is our problem, not NAU specific, but this is a humanity crisis.
Suicide has been a prominent issue for decades, and it's a touchy subject.
But tomorrow we will tell you how some students took an action to make an improvement in mental health services, hoping to make a local impact. I'm April Hettinger.
And I'm Cassidy Zimmerick, NAZ Today.